The Hartford Nomogram is a tool used to determine the dosing interval for aminoglycosides, like gentamicin, tobramycin, or amikacin, when using extended interval or once-daily dosing. This dosing strategy exploits the concentration-dependent bactericidal activity and post-antibiotic effect of aminoglycosides, aiming to maximize efficacy and minimize toxicity. Talking about the purpose of Nomogram, Hartford Nomograms simplify aminoglycoside dosing and monitoring. It also reduces risks of nephrotoxicity and ototoxicity. Moreover, Nomogram also optimize bacterial killing by achieving high peak concentrations. Moving towards various steps to use the Hartford Nomogram. First, calculate initial dose. The recommended dose is 7 mg per kg, based on ideal or adjusted body weight. Administer the full dose as an intravenous bolus infusion. Moving forward, obtain a single serum aminoglycoside level 6 to 14 hours after the dose. In the end, plot the drug level on the Nomogram. The Nomogram uses serum concentration on the y-axis and time after dose on the x-axis. Based on where the drug concentration falls, the Nomogram indicates the appropriate dosing intervals, which ranges from 24 hours to 48 hours. Let's talk about a practical example of how to use Hartford Nomogram. A 70 kg adult is prescribed gentamicin for a gram-negative infection. Dose administered is 7 mg per kg multiply by 70 kg, which is equal to 490 mg intravenously as a single dose. After 8 hours, a serum gentamicin level of 9 microgram per ml is measured. Plot the level, 9 microgram per ml, at 8 hours on the Hartford Nomogram. If the value lies in the 24-hour range, the next dose should be given in 24 hours. If it lies in the 36 or 48-hour range, the dosing interval is adjusted accordingly. Talking about the limitations, Hartford Nomogram is not suitable for patients with significant renal impairment where creatinine clearance is less than 60 milliliters per minute, patients with endocarditis, or those requiring traditional multiple daily dose regimens of aminoglycosides. Second parameter is to assume steady-state pharmacokinetics and normal hydration. In the end, talking about clinical benefits of Hartford Nomogram, this graph has high efficacy for gram-negative infections. It reduces the frequency of aminoglycoside monitoring compared to traditional dosing. It also decreases nephrotoxicity and ototoxicity associated with prolonged aminoglycoside levels. In summary, by simplifying aminoglycoside dosing, the Hartford Nomogram ensures effective and safer treatment. So that's all for today. Hope you liked this video, and as always, stay tuned for more. Thank you.